Representative Liebling, thanks for joining us today and letting us interview. Can you describe your district and tell us in what ways you and your district are similar?
Well, my district is 26A, which is part of the city of Rochester, kind of the core of Rochester. It stretches from the community college all the way through downtown, the Mayo campus, kind of east to west across the southern part of the city, I would say. And it's a very diverse district in every way. It's diverse economically. It's diverse in racial and ethnic categories. It's diverse in age.
How are you a good fit?
I think I really am a good fit for the district. I'm now in my 5th term. I think I interact comfortably with a lot of different sectors of my community. So I feel very comfortable with the working people in my community, with the different ethnic communities. I really enjoy interacting with different ethnicities and people from different places. I have a public health background and I work on healthcare and human services, so I fit with the medical community because obviously it's very, healthcare is a huge part of the district since the Mayo Clinic is there. So that's a very good fit.
What is your occupation outside the legislature?
Well, I'm a lawyer by training. I do have a public health degree, so when I started running for the legislature, I pretty much had to close down my law practice. So I've sort of practiced law sporadically. I keep up my law license, but I'm not really actively practicing law. So I would say right now I'm pretty much a full-time legislator. And certainly being a committee chair, I just don't see how I could do otherwise, because it really is a pretty all-encompassing kind of thing.
What legislation have you worked on in the past that you are most proud of?
I've done a lot of things that I haven't necessarily had my name on as the chief author. So for example, extending marriage equality is something that I'm very proud of and really thrilled to have been a part of. Even though it's obviously, I didn't carry the legislation, but I was certainly active in making it happen. Expansion of medical assistance, which happened in the last session under the Affordable Care Act, and you know, a lot of pieces of just trying to make health services better and more available for more people in Minnesota has been something that I've worked on.
If you could go back and visit any time period, what time would you travel to and why?
I very much like living in the present. I just came back from a visit to Israel, and Jerusalem in particular is a place where you are really aware of all the different times that people have lived in. I mean, even the city of Jerusalem is built layer upon layer. There are different civilizations that are represented physically underneath the ground that you walk on in Jerusalem. And so I just spent the last couple of weeks learning a lot about that history. And you know, that was very interesting, and I know that we live in a world with a lot of challenges presently, but we also live in a world with a lot of possibilities that really have never existed before in human history, and I'm really glad to be part of that.